Dear students, welcome to Indian Academy Degree College Autonomous. I am Dr Pushpa R from Department of Biochemistry. You want to know more about diabetes mellitus? So you have to join this session. So in this session, you will know more about diabetes mellitus, what are its complications, what are its types, and how to manage diabetes mellitus. This diabetes mellitus is not a single disease, it's a disorder, it's a clinical condition in which you will see so many complications like the blood glucose level will be higher than the normal range. So the normal range of blood glucose level will be generally 80 to 120 milligrams per 100 ml. But in diabetes mellitus, the level will increase beyond this range. So as a result, the glucose also will appear in the urine. Thus, it gets the name as diabetes mellitus. So there are two types of diabetes mellitus, type 1 and type 2. So before going into the types, let me introduce a hormone which plays a very important role in diabetes mellitus, that is insulin. So in general conditions, whenever after meals the glucose in the body increases, so pancreas will release this hormone. And this hormone, its role is it will make the cells to use glucose. So whatever glucose is excess in the blood, it will enter into the cells, and thus the cells will use it for energy. But if insulin is not able to do this, if it is inefficient in its action, or if there is insufficient insulin, or if there is a deficiency of insulin, then the cells cannot take the glucose. So then what happens is this glucose will start accumulate in the body, and thus it will cause so many complications. One more thing you should remember is this diabetes mellitus cannot be cured, but it can be managed. So there are some complications if it is not properly controlled, like it will affect the eyes. So it may lead to complete blindness, or it may affect the kidneys. Kidney failures can happen, heart failures can happen. So it has to be managed. This diabetes mellitus patients, they generally have some common symptoms like polyurination, and because of loss of lot of water, it will lead to dehydration, and they will have lot of thirst, extreme hunger, body weakness, tiredness. These are the main symptoms. Along with these symptoms, they will also have weight loss, blurred vision, and their body will be having lot of sugar, so they will be also prone to several types of infections, and wound healing also will be very slow in diabetes patients. So now in very brief, we will see what are the two types of diabetes. So type 1 diabetes, it is starting at the age of 12 years. So it is also called as juvenile onset, and mainly it is because of lack of insulin. So if insulin is not there, then the sugar levels cannot be controlled, and it will lead to hyperglycemia, and finally it will go to diabetes mellitus. So if you give insulin to such patients, then the problem can be solved. So this type of insulin dependent diabetes mellitus can be cured by insulin. And one more type is non-insulin dependent diabetes mellitus, or type 2. There the main problem is insulin resistance, means cells will be having insulin in the body, but the insulin will be ineffective in its action. So as a result, the cells cannot use glucose, and the glucose level will increase. So if you give insulin, it will not be alone enough for such individuals. So they have to control their diet, they have to do regular exercises. So like that, there are several things which these individuals should manage, because it cannot be cured, so you have to manage it, doing regular exercises and eating proper diet plan. And nowadays we are also having in houses glucometers, so regular glucose checkups we have to do. So I hope you have understood the basic concept behind the diabetes mellitus, its types, complications, and how to manage it. So still, if you have any doubts, students, you can contact me. Thank you so much.